Hi everybody, my name is Heidi Galarza Argudo and today's topic is Macitentan and morbidity and mortality in pulmonary arterial hypertension. Pulmonary hypertension is a type of high blood pressure that affects the arteries in the lungs and the right side of your heart. Although pulmonary hypertension isn't curable, treatments are available that can help lessen symptoms and improve your quality of life. For example, Macitentan, which is an endothelin antagonist.
The heart is a beating muscle that pumps oxygenated blood to the entire body. After leaving the heart, blood must first pass through the lungs to receive oxygen before it can go to the body's cells. In order for blood to move from the heart to the lungs, blood must travel through the pulmonary artery and then into smaller and smaller vessels of the lungs. The diameter or tone of these blood vessels is regulated by a substance called endothelin, which circulates in the bloodstream. A condition called pulmonary hypertension is marked by a large increase in the amount of circulating endothelin, causing the small arteries of the lungs to narrow. When the arteries of the lung become narrowed, increased resistance to blood flow develops, thereby necessitating the heart to work harder to pump blood to the lungs. At the same time, the lungs work harder to bring more oxygen into the body. This condition causes the blood pressure in the arteries of the lungs to become abnormally high. Because the heart has to work harder to pump blood, the right side of the heart may become abnormally enlarged and heart failure can develop.
Application in medicine. Macitentan is indicated for treatment of pulmonary arterial hypertension to delay the disease progression because it reverses the effect of endothelin, a substance in the walls of blood vessels that causes them to narrow.
The Seraphin trial was a really unique trial in that it was a morbidity and mortality trial, which is the first ever in pulmonary arterial hypertension. The Seraphin trial examined the effects of a new endothelin receptor antagonist, Macitentan, on the time to worsening or a morbidity mortality event. And that was defined in a number of ways, a composite endpoint, if you will. And the results of the study, which were presented several months ago, clearly demonstrated that Macitentan compared to placebo significantly improved morbidity and mortality in pulmonary arterial hypertension. As part of that study, what we also looked at was a subgroup analysis related to one of the secondary endpoints, which was reduction in hospitalization due to pulmonary arterial hypertension or death due to pulmonary arterial hypertension. And the results that we presented at the American Thoracic Society demonstrated that Macitentan clearly decreased the hazard ratio for death or hospitalization due to pulmonary arterial hypertension. Specifically, patients on the 10 milligram dose of Macitentan had a risk reduction of 50% for death due to PAH or hospitalization due to PAH. The 3 milligram dose group had a 33% risk reduction. So these were both statistically significant results. In addition, confirmed that the safety of the drug, which has been shown again previously in the presentation from several months ago. The implications of our results showing this improvement in hospitalization for pulmonary arterial hypertension really, I think, could be quite significant. Certainly, hospitalization for pulmonary arterial hypertension is a significant event affecting patients' quality of life, certainly potentially affecting cost of care. So, an agent shown to reduce these hospitalizations could certainly have impacts long-term on those parameters like quality of life and potentially even pharmacoeconomics, although this study wasn't designed to look at that specifically.
Pros and cons of the treatment. Pros. This treatment is safe and efficient because it reduces morbidity and mortality among patients with pulmonary arterial hypertension. The morbidity and mortality criteria are important to choose the ideal treatment. And cons, it has pregnancy contraindication, hepatotoxicity and liver failure, and pulmonary edema.
How to recognize the symptoms of liver disease. Liver disease is a broad term for conditions, diseases, or infections that can make the liver function improperly or stop liver function altogether. Use this guide to help recognize the symptoms. You will need jaundice, a loss of appetite, nausea, changes in weight, vomiting, diarrhea, light-colored stool, dark urine, itchiness, pain, behavioral changes, a liver function test, and a doctor. Optional, a family history. Step 1. Learn what causes liver disease, including viruses, bacteria, and chemical or physical changes. Liver disease isn't always accompanied by obvious symptoms. Check your family history. Liver disease can be hereditary. Step 2. Look for yellowing of the eyes or the skin, also known as jaundice, which is a clear indicator of liver disease. Step 3. Pay attention to changes in your relationship with food and eating, including a loss of appetite, nausea, changes in your weight, and vomiting. Step 4. Check your urine and stool. Liver disease symptoms include diarrhea, light-colored stool, and dark urine. Step 5. Feel the itch. Liver disease can give you an itchy sensation that cannot be relieved. Step 6. Know what type of abdominal pain occurs with liver disease. Pain is typically in the upper right part of the stomach. Pay attention to muscle aches and pains as well, as these can also be a symptom. Step 7. Look for changes in behavior, including depression, a loss of sex drive, fatigue, and a vague feeling of illness known as malaise. Step 8. See your doctor and get a liver function test. If you have liver disease, your test will come back as abnormal. Talk with your doctor about the steps you need to take for treatment. Did you know the liver is the largest organ inside the human body?
Disease. The symptoms are shortness of breath, called dyspnea, initially while exercising and eventually while at rest, fatigue, dizziness, chest pressure or pain, swelling edema in your ankles, legs, and eventually in your abdomen, called ascites.
The common symptoms women experience with pulmonary hypertension are shortness of breath, that's the main symptom, fatigue, tiring easily, and fluid retention, swelling in the legs and the feet. For instance, I had a patient just recently with pulmonary hypertension who came in and told me that she had been having more swelling in her feet. She was having to take more water pills to control this, that she felt tired all the time. She would get up in the morning and within an hour or so she had to go back to bed and rest, and that her breathing was becoming much more labored with less activity. Just walking up a flight of stairs was causing her to become quite short of breath. And this told me that her condition was getting worse and I might have to make some modifications in her treatment.
So, test and diagnosis. Blood test, chest x-ray, Doppler echocardiogram, transesophageal echocardiogram, right heart catheterization, pulmonary function test, perfusion lung scan, and open lung biopsy. The complications are bleeding, arrhythmia, blood clots, and right-sided heart failure. Thank you very much for your attention.